Hello everyone, this is Dr. Peters this side, and I would understand that people would be wondering that we are talking about menstrual health, and here we have a surge in talking about menstrual health. So dear ladies, welcome to the session, and we are talking about menstrual health because we will be talking about association of menstrual irregularities with obesity. Yes, so we would be talking about how overweight or being obese impacts your reproductive health and the menstrual health. Now to define or to start, let's define obesity. Now, as we all understand that till some time back, we all used to think that obesity is more like a health lifestyle disorder wherein, we are slightly chubby and so it was okay. Do we understand and do we know that WHO has recognized obesity as a disorder, as a disease? Yes, it has been classified as a disease now. So to break it into very simple words, there is an ideal weight that we should weigh. That means for a typical height, we should weigh approximately between that range. Now, how do we calculate that? The easy and a simple formula would be, for a lady at about 5 feet, you should be weighing close to about 45 kgs. And for each inch that you increase your height, you should add about 3 kgs. So let's say if you are 5'3", so 45 for 5 and 3 into 3, that means 9. So 45 plus 9, about 54. So your ideal weight becomes close to about 54 kgs. This is a very rough estimate. The other way to do it is to see your BMI. That means your body mass index. And this is a formula wherein your weight in kgs is divided by your height in meters square. That means weight divided by height in meters into height in meters. And if you take this formula and calculate your BMI, what you will see that people, anything between 18 to 22 and a half is taken as good BMI, till about 25 is taken as overweight, and once you cross 25, and this is the recent guidelines, earlier it was taken around 27 and a half and above as class 1. Now we take 25 and above as class 1 obesity, more than 30 as class 2, and more than 35 as class 3. For the Americans, it is about 2.5 to 5 points higher. Why? Because what we've seen in Caucasians that at a lower BMI, we have a much higher risk or cardiac risk. So this is how you define obesity. And now, as we see, obesity can be linked or can be precursor of a large amount of disorder associated with your body. So if we go from head to toe, it can be associated with headaches, with migraines, increased cardiac diseases, type 2 diabetes, OSA, infertility and menstrual irregularities in females, infertility in males, and so forth. So today let's focus about obesity and menstrual irregularities or menstrual disturbances. Now, as ladies, you would understand we attain an age wherein we start having menstrual periods or cycle called menarche, which can vary from anything between 10 years to 15 years in different ladies. It has a lot of genetic predisposition, a lot of hormonal balance, and probably in some families, some ladies get periods much earlier than in a few different families. Now, once you attain that, a typical menstrual cycle will have a phase wherein there is surge of the hormones. So your endometrial thickening or the lining inside the uterus becomes thick, and then the hormones dip down, there is an ovulation, and then you have a menstrual period. That means there is the shedding of this endometrium once there is no pregnancy. So this is a typical cycle. Now what happens in obesity? A lot of ladies, they may have menstrual irregularities. Why? Because the hormonal surge doesn't happen well. So you can either have menstrual irregularities, that means your cycles may be delayed like 2 months, 3 months, 4 months. You can have spotting in between your periods, and more importantly, even though you are having your normal cycles, the cycles may be anovulatory. What does it mean? It means that though you have a cycle, you still do not produce a healthy ova, so that fertility is at danger. So you do not get fertile and there is no fertilization happening. So these type of problems are extremely common. Second is because of insulin imbalance or insulin insensitivity, there could be PCOS, that means polycystic ovarian disease. That means small cyst or small little follicular cyst form in your ovaries, and that is a very common thing of PCOD associated with obesity. So these two are extremely common and which causes infertility. So dear young ladies, if you are obese or if you think you fall in the category of being slightly overweight, your cycles are not regular, or if you do an ultrasound, which is a regular ultrasound, and you see that you have small amount of cyst, if you do your insulin level and they are increased and you have insulin insensitivity or resistance, then you must please go and talk to your gynecologist. You can talk to your family physician, or you can even come to an obesity surgeon who would be able to guide you what is the right process of dealing with this.
Thank you, doctor, for your insights. We have a couple of questions pouring in. The first question is from Riya Sharma. She asks, what lifestyle modifications can help me break the cycle of obesity and menstrual issues?
I understand this question very well because this is a common question asked by me almost by all my patients. Now we must understand, like obesity doesn't come in a day, similarly the solution to obesity doesn't come in one day. So number one and the most important thing is there are no quick fixes. There are no magical drugs. It's a slow process. It's a long process of self-discipline and consistency. Now self-discipline would be coming both in terms of your eating and your physical work. So if you are consistently eating right food, what do I mean by right food? A well-balanced food, low in carbs, low in fat, high in proteins, and when I say high, that would mean approximately 1 gram per kg per day. So if you take this diet, do not keep yourself hungry for a very long time, smaller meals, frequent intervals, added with some amount of physical exercise. Now don't get into this habit of, these Fitbit and watches, I walk 10,000 steps, I have 7,000 steps. These are of no use, right? You need to do a regular exercise, or you need to do consistently increase your heart rate to a target heart rate and do it consistently for about 20-25 minutes. So a good healthy nutritious diet, good amount of protein with some amount of exercise, which should be at least 4 to 5 times a week consistently for about 20-25 minutes is what is going to help you beat obesity. And once you beat obesity, PCOS and insulin resistance will come better and will be better in a few weeks to a few months.
Thank you, doctor. The next question is from Dipinita. She asks, how does insulin resistance or blood sugar levels affect my menstrual cycle?
So it is an extremely complex mechanism of insulin insensitivity or resistance. Now when I say insulin resistance, what is happening is the production of insulin is not really hampered. On the contrary, you have higher amount of insulin in your body, right? Now insulin is a complex hormone which acts not only on your blood sugar levels but also on many other systems. It helps in positive protein synthesis, it has effect on your liver, it has effect on your muscles, it has effect on your other systems. Now when insulin resistance happens, that means the receptors or the insulin receptors are not well adding or joining with the insulin molecule to have the desired effect, and that is what is called insulin resistance. So you have hyperinsulinemia. That means your insulin level is high, however the end effect on the end organs is not happening, and that insensitivity or resistance actually causes menstrual irregularities. Why? Because the normal hormones of estrogens and progesterones are not working. It's not working on your liver, and so that the normal surge which should happen doesn't happen, and that causes irregular periods and also anovulatory cycles.
Thank you, doctor. The next question is, what tests can help determine if it is my weight that is affecting my reproductive health?
So number one, in terms of the simple way is first calculate your BMI. If you think you are in an unhealthy zone, that means if your BMI has already crossed about 25 or 30, so that is the first indicator that yes, it would be targeting or it would be affecting your reproductive health. The second thing should be your insulin levels. That means you can get your serum insulin level and you would see that there is some amount of hyperinsulinemia. And this hyperinsulinemia along with high blood sugar level will give you some idea about hyperinsulinemia and insulin resistance along with the other hormones like progesterone, estrogen should be done to calculate and to see if you're getting into insulin resistance.
Thank you, doctor. The next question is from Avantika. She asks, how much weight loss would be beneficial for regulating my cycle?
You know, the studies suggest that a weight loss of just 10% can have an extremely positive effect on your insulin resistance. Yes. So let's say if your ideal weight is about 50 and let's say you are 100 kgs, a 10% of the excess weight would be about 5 kgs. So even if you lose about 5 to 7 kgs, this would have an extremely positive effect on your insulin metabolism. But should that be enough? No. So to have a positive effect, you must lose about 80% of your excess weight. I'm not saying 80% of your total weight, but excess weight. Excess, that means which is over and above your ideal weight. So good effect will start with as little as 10%, but ideal weight loss would be about 80% of your excess weight.
Thank you, doctor. The next question is, do conditions like PCOS relate to weight?
Yes, but you know, it's the chicken and egg situation. I see a lot of patients says we've gained weight because we've got PCOS, and I always tell them it's usually the vice versa. Because you are overweight, you are suffering with PCOS. Now, would it mean that all ladies having PCOS are obese? No. So the vice versa is not true. That means PCOS leading to obesity, not really the case. Obesity leading to PCOS, usually the case. All PCOS patients having obesity, not true. All obese patients having PCOS may be likely, but not always true.
The next question is, could stress or poor sleep be worsening my menstrual symptoms?
Oh, absolutely. There is a very narrow balance of all the hormones which play. So a proper sleep is extremely important to maintain a normal balance. Anxiety secretes a lot of hormones, cortisol being one of them, right? Which also works along with insulin and other hormones to disturb your menstrual cycle. So important is that you have a good sleep, and also stress level should be controlled. Now, stress level control, I understand in today's world saying that we should not have stress is not very easy. We have stress of work, family and so forth. But pick up some good habits in terms of a good physical work, do some meditation, some yoga, do something to keep yourself happy. And once you start keeping yourself happy, start doing something for your anxiety. And the most important part of doing something about is first to recognize the problem. So if you recognize that you're anxious, that is the first step. And if you need any help, please don't feel ashamed to go and ask a psychologist or a psychiatrist or other person who can help you with your anxiety. So anxiety and sleep can alter your menstrual irregularity, can also cause PCOS, and can also cause anovulatory cycles.
Thank you, doctor. The next question is, are there specific dietary changes that can help balance my hormones?
So there are no real, again, magical formulations that I can say, okay, if you take this, it is going to be better, or if you take this, that is going to be better. However, a healthy balanced diet, polyunsaturated fatty acids, some amount of fish oil, and also essential fatty acids should be included in your diet, because these essential fatty acids are important. Some amount of fat is also extremely important. So I've seen people going extremely on one side that they start taking zero fat. We must understand almost all our hormones have a basic molecule of cholesterol, which is a fat molecule. So most of the hormones are based out of fat. Our brain is about 90% water and rest is fat. So it is extremely important that we take care that we include some amount of polyunsaturated fatty acids, some fatty acid, and good amount of protein to balance our hormone.
Thank you, doctor. The next question is, does obesity affect my fertility, and what can I do to improve my chances of conception?
So obesity is extremely related to infertility. And when I say infertility, that infertility starts from first getting married, right? Now, obese people find it difficult to have a social partner. And I'm not saying that it's difficult to find, and you could be in love and you could find a good partner. However, in our subcontinent, obesity is a problem. Number one, finding a partner. Number two, having a physical relationship with a partner may be difficult. And it is usually seen in the last 3 decades of practice, partners. So if one partner is obese, the likelihood of the other partner being obese is slightly more. So having a physical relationship between two obese partners becomes difficult. Third is infertility because you have anovulatory cycles. That means you may be having regular periods, but your cycles are anovulatory. Third is because of the male partner, the male, if is slightly on the heavier side, will have some amount of oligospermia or azoospermia. That means the sperms could be of low quality or immotile or dead sperms. So both the partners will have suboptimal or subnormal fertility. And then conception, that means fertilization is a problem. And then the embryo which gets attached to the lining of the uterus, that becomes difficult. So in all stages of reproduction, obesity plays a role. So if you are obese, or if you think that you're on that line of obesity, please take care of yourself, because in longer run it can cause infertility.
Thank you, doctor. The next question is, are there medications or supplements that could help regulate my periods?
Oh yes, and I would not want to comment too many things about regulation of the periods. I think that's the domain of a gynecologist. So if you are having a problem with your menstrual irregularities, and if you're obese, I think you must consult both your bariatric surgeon and your gynecologist, who can work up all your hormonal test can be done. And if it is related to obesity, yes, certain drugs can be given to you. And if it is not related to obesity, then I think your gynecologist would be a better person to suggest drugs which can be given to regulate your menstrual cycles.
The next question is, how can I differentiate between normal period irregularities and signs of a more serious condition?
Again, I think if you take in terms of just menstrual period, a normal flow could be anything between 3 days to 7 days. A few ladies will be over with their flow in about 3 days, some may take about 7 days. So there is a normal variation. These normal variations can be in families because of genetic, because of your hormonal play. So anything between this is taken as normal. And again, the cycle can be anything between 21 days to about 35 days. That's again taken as normal. So different people or different ladies will have a different period cycle. And for this, again, I would advise that you should, and if you're not obese, and if you're still having menstrual irregularities, I believe you should see your gynecologist, and they should be the one who should be evaluating your menstrual irregularities, and they should be the one who should be treating you.
The next question is, are there any long-term risks like endometrial hyperplasia or infertility if my periods remain irregular?
So endometrial hyperplasia is when your lining of the uterus becomes more active and it has much thicker lining. So that's endometrial hyperplasia. That normally can happen because of hormonal imbalance. That is number one. It can also happen in PCOS. Now both these things, if related with obesity, then obesity is to be blamed. But if this is happening in spite of you being in a normal weight, then yes, it needs to be investigated. It needs probably an ultrasound should be done. Your hormonal test should be done. In a few cases, probably a DNC or an endometrial biopsy should be done to see why it is happening. And again, I would suggest that you meet your gynecologist, because they would be the one who would be deeply digging into the problem of hyperplasia and menstrual irregularities if it is not associated with obesity. If it is associated with obesity, yes, you must talk to your bariatric surgeon, your bariatric physician. They could do your hormonal assay along with the gynecologist and do a good plan for you.
Thank you, doctor. The last question is, how often should I follow up to monitor improvements in my menstrual health?
I think every month, because you have a monthly cycle, so each month is a good time to see how your menstrual health is. That means if you have been having a excessive flow or scanty flow or mid-cycle spotting, or you've been having a lot of pain and cramps, then each month you can actually follow up to see how you are faring with either dietary modifications, certain drugs, and if you are on a path to do weight reduction. So you should follow actually each month. So it's not that every 3 months or 6 months you should do. Yes, in terms of getting you investigated for your ultrasound, probably 3 to 6 months is the right time. But then again, you should follow up closely with your gynecologist, because they should be the one who should be telling you how closely you should monitor yourself with ultrasound or with an internal examination.
Thank you, doctor, for your valuable insights. Any last concluding message that you would want to pass on to our audience?
Yeah, so dear ladies, as I started early, that obesity is a killer. Obesity is a disease and it relates to your menstrual health in a very, very complex way. It not only can cause PCOS and insulin resistance, it can cause infertility and it can cause menstrual irregularities. So if you think you are in a category of being overweight or obese, please talk to your surgeon, take care of your diet, see to it that you make a very practical diet, include certain exercises in your daily routine, so that you can slowly, gradually, consistently lose some weight. Because once you start losing weight, the good effect of losing weight will show not only on total health but also your reproductive health.